So my name is Kirsty Blades, and I am the CEO at Palliative Care New South Wales, for those of you that I haven't had a chance to meet before. Really grateful for you all joining us online this morning. I would just like to start by saying that on behalf of Palliative Care New South Wales and also all of our speakers that are here this morning, that we do wish to acknowledge the traditional custodians of the land where we're all joining from this morning, which will be all across many different lands based on where you are from. For me today, I'm joining from the land of the Gadigal people of the Eora Nation, and our speakers today are joining from the land of the Dharawal people. We really want to make sure we pay our respects to traditional owners, their culture, their people, and elders past and present. And for Palliative Care New South Wales, this is something that we are really passionate about. It's an area that's incredibly important, and we are committed to making sure that we're walking with and learning from Aboriginal and Torres Strait Islander people on their care journeys as well. So a little bit of quick information, just in terms of Palliative Care New South Wales and who we are and why this has been something that we have really felt was important that we supported. So we are a peak body. We have been around for just over 40 years, so have been around for quite a while. And we represent the interests of healthcare professionals, people with life-limiting illnesses, their families and carers, and the general community. We really advocate, so we have a strong role in advocacy into the government and into communities, ensuring that palliative care is accessible and equitable to all. So that is something that really drives us every single day. We do quite a lot of education and awareness, and that's from clinician education to raising awareness within the community and education at a community level as well. And education is exactly the reason why we are here and talking about this morning. We're really delighted to have partnered with Southeast Sydney, LHD, to host this fantastic new e-learning module, which is a communication skills in palliative care module. We know how important communication is in the provision of quality palliative care. And that's not just in the specialist palliative care realm, but across anyone that is having contact with people who do have a life-limiting illness and their families and carers. So primary care, community nursing, those working in aged care, this is a very relevant topic for everybody, which is why we're excited to be supporting this as well. We did want to make sure this module was available to as many people as possible, so it is open access. It does not require you to have a password. You do not need to be a New South Wales Health employee to access this module. So really opening up the ability for people to engage with this. And at the conclusion of doing the module, you do receive a certificate of completion, which may be useful for anything you have in terms of your accreditation or CPD points as well. So before I do introduce the team, just want to let you know there is time for questions at the end. Please use the chat box if you'd like to comment at any point along the way or would like to put a question in there that we can come back to later. So please do use that functionality. So the real brilliance behind this module is definitely the team at Southeast Sydney LHD who saw this need and have responded to this need and developed this module. In particular, Dr. Amy Waters, the staff specialist for palliative medicine, and Sue Morris, the palliative care clinical nurse educator at St George Hospital, Kogarah. They're both joining us here today to share their insights. So we want to welcome Amy and Sue, and I'm going to hand over to Amy to take it from here.
Now, hi everyone, thanks so much for coming, and thank you again to Kirsty and Palliative Care New South Wales for hosting our resource. So I am coming to you from the land of the Bidjigal people of the Eora Nation today, and I just want to acknowledge that. Just a little bit about me. So I'm a palliative care physician working at St George Hospital in southeastern Sydney, and that's where I've been working as a specialist since I completed my training in 2008. So I've always actually really loved medical education. I think it's a huge part of what we contribute to our specialty. And I actually did a Master's of Medical Education, which I completed in 2012 through the University of Sydney. And I actually became interested in communication skills training at around the end of my own training in 2008. That was about the time that a 3-day communication skills workshop was set up by some of my amazing colleagues for our trainees in palliative medicine. And I went on to become a facilitator in that workshop and really built my own communication skills, but also my own experience in teaching other people communication. So we ran that workshop up until 2019 when COVID hit and derailed everything. And I and now so we've really changed focus now, and we're involved in trying to expand access to communication skills workshops across Australia and New Zealand using shorter workshops. And we are working on access to those types of workshops for several medical specialties, but we also recognise the need to open up communication skills training to other health professionals. And for instance, I have a colleague in Queensland who ran workshops for nursing and allied health earlier in the year, and that's, it's such a huge need. So I'm still involved in that. I still teach those workshops, and I'm really involved in mentoring other facilitators as we build our capacity to keep on teaching these skills. So in terms of my role in this project, I was the lead in content development and also led the scripting of the videos. But I really did rely on Sue's input, and I'll hand over to her in a sec to talk a little bit more about her role. But I obviously come from a medical background, and I really needed Sue to be a key part of this project to make sure that the content and the scenarios were appropriate for a nursing audience. And I also really want to acknowledge Don Francis from Inky Smudge, who was the one who turned this into the e-learning resource. So he was the one who, was able to transform all my Word documents that I sent him into the interactive, engaging resource that you see that we'll demo in a bit. I guess the other thing to say is, the content that you will see in the resource, it's not just me. That's the collective wisdom of a huge group of communication skills teachers that I've been working with for the last 15 years. So really, it's the voice of a much bigger group of people. And we've all been trained and have ongoing mentoring with Vital Talk in the US, who do a lot of communication skills training there, and are very, very supportive of what we've been trying to do in Australia. So I really want to make it very clear that I'm a voice of multiple other people in developing these resources, and we couldn't have done it without all those people.
Hey, I'm Sue Morris. I'm the clinical nurse educator here at St George Hospital in Sydney, and I've been very fortunate enough to work with Amy. I've been a registered nurse now for about 40 years, got to say that quick, and 25 years of those have been working in palliative care nursing. And fortunately, I've been able to work across the 3 main areas, which are an inpatient unit back in the days when they were called a hospice rather than a palliative care unit, the community palliative care team at Calvary, and here, excuse me, here at St George's, a palliative care nurse specialist, and also as a clinical nurse educator now on the ward. So it's been a great privilege to be working in both those outstanding institutions. And so for me, my role with Amy in this was to bring the nursing perspective, as Amy has said, and to make sure that the content was fit for purpose in that role, and modify any, scripting issues that, to make it from a nursing perspective. I was able to do co-piloting with some of my colleagues on the wards using this resource in its early stages with some of the other nurses. And seeing not just in traditional palliative care wards like oncology and hematology, but aged care, gastroenterology, cardiology, just to see whether it had that broader applicability for not just traditional nursing palliative care situations. as palliative care has developed, we all know it's now extending well into non-malignant areas with lots of supportive care services now involved there. So it's really important that this was applicable across those other areas as well. So that's basically my main role, is to make sure that it was fit for purpose for nurses.
Fantastic. So I think we're going to hear a little bit more now from Amy and Sue around what are the benefits of enhancing communication and skills, and these skills for those difficult conversations, which they can be at times. And we're going to see a little bit, Amy and Sue are going to be co-presenting this next bit to demonstrate what those insights and benefits are as well. So I'll hand it back over to the both of you.
So I might just sort of start off with a really broad overview, and I think Sue's going to talk a little bit more again about the specific nursing perspective on this. So I guess, we all find these conversations hard. I mean, Sue and I still find these conversations hard, and we've been doing this for a really long time. So that's, we really recognise that this is such a challenging part of working with people with palliative care needs. But it's really crucial. And I think the first thing to say is that we know that skills for having good conversations can be taught. Communication skills can be taught. We can all continue to improve our communication skills, and that's really contrary to what some people believe. But I guess that's a really key thing that underpins our sort of passion in doing this work. These are teachable skills, and I guess the other thing to really reinforce is that we know that good communication skills have so many benefits for our patients, but also for us. So there's good evidence and a lot of research out there that shows that having good communication skills increases patient satisfaction. It improves patients' adherence to their treatment plans. And it actually, really crucially for the patients that we see, it actually reduces aggressive interventions at the end of life. But there's also really important benefits for us as clinicians. So having good communication skills makes us more efficient. And we all know how time pressured everyone's jobs are, particularly these days. And I think that's actually getting more and more prominent as medicine becomes more complex. So it makes us more efficient. But it also reduces clinician burnout. And that is an increasingly important issue for us all. Across the board, it's a really, really big problem in healthcare now. So anything that we can do to help ourselves as clinicians, I think is really, really crucial. And that's where that's the other reason that we really are very passionate about this type of work. So look, communication skills, as we know, are often taught in lecture form, medical education, people to improve their skills. It's just not going to work particularly well. Actually, the style of training that has the most evidence for people actually changing their behaviour are the workshops, and they are fabulous. They're also really resource intensive. So I guess we're hoping that this resource provides a widely accessible, but also really engaging and interactive education on 4 key communication skills that if we're able to actually put those into practice, those key communication skills will actually make the majority of our conversations easier. So that's kind of the broad overview of what of what we see the benefit of this type of training. And I might just hand over to Sue to give.
Thanks, Amy. As I was looking at the research around communication skills for nurses, it was really obvious that nurses either feel uncomfortable in engaging in these kinds of conversations, or they actually don't see it as part of their role necessarily. And I think that was, and what we do know, as Amy's outlined, that good communication skills for nurses enhances best outcomes for excellence in practice and safe practice. So I think it's really important that that's acknowledged, that for nurses, it's not, there's a huge emphasis on technical skills for nurses, and those soft skills is what, communication skills is often considered, maybe don't get the the focus that they need in undergraduate nursing.
To have lost you there for a minute. Oh, you're back.
Sorry, you just went off the back of the computer. I'm sorry about that. Hello. So what I know anecdotally in my role, especially in educating in palliative care, is that for nurses, the thought of saying something that would distress a patient or family at the end of life is huge. You know, and for them, they just don't want to do the wrong thing. They don't want to cause any more difficulty or distress for a family that's already very distressed. So, you know, being able to make a referral to the back to the medical team, or perhaps to a social worker, is often a way, and nurses may deal with that anxiety and to make sure that you know that the best thing is happening for the patient. So, you know, that was a concern for me, that I understood that for nurses when they're trying to do these more difficult conversations, and we were keen to just let nurses know that these skills are fundamental across, you know, your life. They're not just around skills for work, which is what we're trying to enhance, but they're also helpful in your personal life as well, and that they're fundamental. That doesn't mean they're basic. That's one thing I really have learned from Amy is, you know, when you say fundamental, you think, okay, basic, but they're not. They're the skills that we all need to be able to communicate well, particularly at work. And that being able to respond can really help that miscommunication, or patients or families getting distressed around not understanding what's happening. So having those skills of being able to say, can you tell me what your understanding is of what's happening, is a really great skill for nurses to be able to have, to get the information that they need to be able to then move on in a conversation with a family and not go over information that you don't need to. So that's a really important way of making that communication or that conversation efficient as well as effective. For me, I guess, you know, watching nursing over a very long time, the issue of time poor nurses is huge. You know, the acuity within the hospital system, and that's across community as well, means that nurses are just working at full tilt, and, you know, being able to give them some skills to help make that environment easier without them feeling overwhelmed that this is just something else that they're expected to do, and would feel like they're going to push them over the edge almost with how difficult it is for nurses in the environment that they're working in at the moment. So not only do they have time constraints, the patients are really high care needs across, you know, you don't get into a hospital bed these days unless you are really unwell. It's not simple anymore. Gone are the days when, you know, somebody would stay in for an extended period of time for an appendicectomy. They're out and gone within a day or two. So it's been a huge change on that turnover and the amount of care that people need. I think for nurses, it's really difficult to get away from being task orientated, because we are, you know, that is a big part of our role, is getting through a certain amount of tasks and ensuring that, you know, patients are well cared for and given excellent care. But with that, like I said, becomes, you know, dealing with a challenging conversation in the middle of that is something that I think for nurses can really be difficult to try and engage in. So it was about trying to give skills that were teachable, were learnable, and they could actually use them. I know in the module, we certainly use all of the skills in the actual video scenarios. But I think it's important for nurses to know that those individual skills can be used at different times when they're working with their patients, and that even to be able to learn to recognize emotional cues and be able to pick that up and acknowledge that. And if they're too busy, say, I can see that you're really anxious or concerned about that. I'm just not able to chat at the moment. I have to do some things, but can I please come back and talk to you about that? Or would it be possible for me to pass that on to the team, or would you be agreeable for one of the social workers to come and talk to you? I think that's a really good way of using the skills too, to be able to say, if they can't engage in that conversation because of their time constraints, they can at least acknowledge that, and then, make a plan with the patient or the family member to come back and address that. So I think that is an important part of learning those skills as such. I think for me, in my journey, as a nurse, it's been very difficult to learn how to use silence. As a busy, task-orientated profession, being able to silence yourself and not be thinking about what you next need to say is something that is challenging, and just to be able to get nurses to sit with that, to just give themselves a little more space when they're talking to people. And as the videos show, it's only a matter of minutes that we're talking about. We're not talking about 10, 15-minute conversations. So it might only need to be a 30-second silence, but that can feel like 5 minutes, when you're busy and need to have a whole lot of other things to do. So those aspects were really important that we showed in the videos, that silence really does work, particularly when people are dealing with difficult emotions and they need that time just to connect with that and get their thoughts about what's happening. And I guess for me, talking to RNs on the ward, they are really keen to know how to do good conversations with patients at end of life. They're aware of it, and they do want to support patients in the best way they can. So being able to get this tool together, this module, has been a great experience, I know, for me, and I know for Amy as well. It's been great. So, yeah.
Fantastic. Thank you, Amy and Sue, for some of those insights on where this has come from and some of the development that you've gone through. I think for me, what was really clear hearing this was to know that it was obviously evidence-backed in terms of, Amy, what you were sharing, but then also backed in reality of the challenges nurses face, which is then, Sue, what you brought into the team and the role, and how you've looked to address these. And so I think that really talks to then what this tool is aiming to address, is that you've had that real insight and consideration of realities in these different situations. So that's really fantastic to hear as well. Did we want to have a bit of a look at the tool? Should we go to that point now? So you should be seeing our website at the moment, so palliativecareNSW.org.au. And then what we've added is along the top in our menu bars here is a new menu drop down. So it's called Education. And the first one that you will see is the online training module. You click on that, and that will actually open up the module into a new window, which, there we go. Okay. So then it opens up on, and we're now in the module here. So Sue or Amy, do you want to take us through what we're seeing on the screen and how you navigate this?
Thanks. As you can see, the main way of negotiating the module is down in the corner, there where it says Get Started. So that continues all the way through the module. The first probably 5 to 10 pages of the module or slides are around the content information around the skill itself. So it does actually go through the key skills. Don's been able to put some interactive things in there for us to actually help understand that. And of course, we've got references that are dotted through the content as well, if people want to find some more information around that. So it goes through the 4 communication skills. As you can see there, ask, tell me more, noticing cues and responding to emotion. And then it goes through those individual things and about some of the myths that we think are happening, and some of the reasons maybe why we don't, or are frightened to do communication skills in general in this particular population or this situation in palliative care, or the setting of palliative care, I should say. Yeah, so it is good. It's interactive. It's bright. It I think keeps your attention, which is important. The cartoons help, you know, give more context and understanding to what we're trying to do. The why is this important are particularly good little information boxes that help you understand a bit more about why that particular skill is really important.
Sorry, so I was muted before and I've managed to unmute myself now. So yeah, so I think that, you know, the first little bit of the resource is the information expanding on those 4 skills, what they mean, what they might look like in practice, and why they're so important. And then we go on to the video scenarios after that. So I think we're just sort of flicking through to give people an idea of what the first bit looks like. We were really trying to make it, you know, just the key bits of information, the really relevant bits of information. We've tried not to overload people with too much, again, because we know that people are time poor, but also, you know, it's not helpful to completely overload people with information when we're looking at education. So we tried to keep it down to the bare minimum, to make it as user friendly as possible. So after we go through the 4 key skills, which is ask, tell me more, noticing cues and responding to emotion, we've then got some our first lot of questions to help people really cement their learning, and try to reinforce what we've been talking about. And you can see, again, Don's done an amazing job of making these look sort of fun and interactive.
Yeah, and it's very intuitive. That's what I find as well, is that you're encouraged to move the mouse around. It's sort of directing you, you know, click on the star, click on the symbol. So it's very intuitive from that perspective as well. I'll go to just for the scenario.
Scenarios that we chose were trying to reflect that broader setting of palliative care across lots of areas in healthcare. And it was important that the situations were as realistic as we could get them for nurses. So it's been really good to get feedback that these were, you know, did actually reflect the feedback I've had from nurses. You know, they felt quite emotional after watching the videos, because that is something that they have experienced in their work life, and that was really good for Amy and I to be able to get that level of engagement around how simple the skills are when we know how to use them. Yeah.
And are the videos featuring, are they animations, or are they actually sort of people acting out the scenarios there?
Yep, if they're real people, real actors, who are demonstrating 3 scenarios. Again, we tried to move away from palliative care being all about malignancy. So there's only one scenario where the patient has a cancer diagnosis. The other 2 are non-malignant, and hopefully, as Sue said, people can relate to this. I guess I do want to acknowledge that the scenarios are all set in a hospital setting, whereas people who will be accessing this may be working in the community. So I guess from my perspective, I it's easier for us to script a realistic scenario based on stuff that we see. So I would have probably struggled to do a scenario based in a setting that I wasn't familiar with. Again, where the skills are so generalizable that we'll hope it will be relatable enough for people who come to this resource out of the hospital system that they'll be able to connect with that and it'll resonate with them. So did you want to add on to that sort of comment?
Oh, no, I agree. I mean, yeah.
Fantastic. Okay, I think that sort of, you can see as well the menu bar on the side, so enables you. Again, I really like this in that what it means is you can go through the module, but then you could also quickly come back into this module. You could bookmark this module on your screen at your desk. And when you know you're about to go into a conversation and a difficult conversation, you could just quickly open this and go back into one of those 4 key skills and do a quick, okay, let me just quickly do a refresh on those skills before I go into this conversation. So it does allow you on this menu to sort of move back to some key things where you go, I just need a quick refresh on this. And that might be just prior to a conversation with a family member or patient. So I really like that usability as well. It's not like you have to be here before you can continue here, etc. So I think that's also a really positive of the module. Sue and Amy, I think what we've found is around 30 to 60 minutes to complete. That's what you've based it on?
Yeah, that's certainly what we're aiming for, again, to make it, just actually achievable for people, given the time pressures.
Yeah.
And I think Sue's experience has so far been, what were you saying to me yesterday, Sue? What's the sort of the general completion time?
Like that 30 to 40 minutes seems to be an average time.
Yeah, which we're really happy with.
Yeah, fantastic
Yeah.
that you could hopefully carve out that time and be able to do that in that time as well. So I'm going to stop sharing that screen, and then Sue, you're just going to share with us a little bit about how we could effectively use this resource within our teams.
Yeah, thanks, Kirsty. I think the 30 to 40 minute time frame was, or the 30 to 60 was something that we thought would suit a traditional in-service time slot, for a lot of organisations. So I have run it on a big screen in a group environment and with 4 to 6 participants, and we have gone through it together as a group. And obviously the group have answered its questions, and then we've gone backwards and forwards till we got it right. This can be really difficult because the font can be hard to see on the big screen and it's difficult to enlarge. I think the best way possible is to have individual iPad or PC, even if it's a ward PC, or your laptop, whatever, and to be able to use it individually with headphones is probably the best way to go. It can't be used on a mobile phone, it's just too complex software to be able to do that. The other thing is I did use it on Friday in one of our courses. We do 3 courses here at St George a year. And so I was able to get iPads that we had been given during COVID to help with patient and family communication during that time. And so I was able to use 5 of those and some of the laptops that were in the skills centre. And again, we had to make sure that people were at a distance that they weren't able to hear, the other somebody else's device at a different situation, or that was distracting. So that was challenging too. So I think, even if ward nurses are able to bring in their own headphones and use potentially one of the work laptop or PC, that might be a good way in a traditional in-service time to do that. I think the other thing is coming back as a group afterwards to be able to just, reflect on how that was, watching some of those skills and what surprised them, what they found was the most helpful, and, you know, what situation would they see that they could use those skills in, is also a good way to kind of complete using the module if possible. I think there's some reflection within the module itself, you know, when you're evaluating. I think that's helpful too. Amy, is there anything you'd like to add there?
Yeah, I mean, just to sort of reinforce that, obviously, we have built in interactive questions, but also reflection, again, with the idea of people really cementing the learning that they are getting from the e-learning module, and to think about what they've learned and how they're going to put it into practice. So that's all built in. Sue's given us some great insights on how it could be used in a sort of a formal education, and, you know, if you've got a formal educational slot. Obviously, people can also just go and, you know, do it solo, and it's designed for that as well. So I think it has so many ways that it can be used. It could be a standalone. It can be sort of almost an intro that people can then build on with, you know, more training, or maybe an actual workshop. It can be used as part of an in-service, as Sue said. So I think it's hopefully the way that can be used, it can be really flexible to, you know, the time and staffing availability that people have, in terms of, do they have a formal education session or not? What sort of time is available? What sort of tech do people have available?
Yeah, no, fantastic suggestions there, and can even see it as it might be, if you've got some regular team meetings, you could give a time frame and say, we're sending this link out, would like before this next meeting, if everyone can take some time to do this, because we are going to spend, you know, 15 minutes on some reflection on that module in that team meeting. So it's great. There's lots of different ways you could approach this. I actually had a question related to that. Is, so what you've sort of clearly demonstrated is it's very transferable skills. It's applicable to across many areas of a hospital, as an example, many different teams. How do you get that buy-in outside of your standard palliative care teams, who we know are passionate about this topic and generally looking for that? But any tips or suggestions about how you get some buy-in from some of those broader teams and wards and other healthcare areas?
Great question. You know, it can be challenging, certainly. You know, there is so much education that health professionals need to have, mandatory and non-mandatory. So, you know, the non-mandatory things can be very difficult to squeeze into the education calendar on the ward. Some of the areas at St George, some of the wards, we've been able to establish pretty good relationships with, and we have a monthly palliative care in service. It's kind of now gone across, say, the medical division, so they will send nurses from the different medical wards. It is challenging, you know. I spend a lot of my time with the new grads trying to build up those skills from the ground up, so to speak. And it is challenging to engage more experienced nurses. I think being able to do the module for those nurses on the, like, even though they're in a group environment, but having the headphones and being able to do that themselves, I think would be something that is helpful. I understand that can be a challenge to get headphones and things for different wards across the hospital, but maybe getting nurses to bring in their own device, you know, that own device to be able to plug it in would be helpful, and that would be helpful for any staff to be able to use it that way, just so they're accessing it and then being able to talk that through. I think taking those opportunities when there has been a difficulty, you know, a difficult death or a difficult conversation or a difficult family, those times are times that, you know, we can use that opportunity to say, it is difficult, it is really difficult. Would you like to have a look at this and see whether, you know, you can understand how maybe that could have been done differently? Yeah.
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 Yeah, look, I think buy-in is a big issue for everyone when we're talking about this type of education. As Sue said, there are a lot of people that still see communication skills as soft skills. And certainly in the medical specialties, I mean, it's very easy to get buy-in from the palliative care community. It's much harder to get buy-in in certain other specialties. And I think, Sue's points are so valuable. I guess the other things I'd add, on top of what Sue said is, really building on her point about relationships. So I think having a relationship with someone in a leadership position to then promote this in your institution or wherever you're working, I think that can be really, really valuable. And I think accepting that the cultural change in terms of the uptake of this sort of stuff and people seeing the importance of this sort of stuff, that actually does take time. People aren't going to necessarily jump on board with this in the next 5 seconds, but if people can slowly build awareness and also particularly if people are finding it really valuable and the word is spreading, that momentum actually gathers over time and it becomes easier and easier to then see this as a really integral part of people's education needs.
Yeah, definitely. That momentum's sort of key, isn't it? And I really like, Sue, that you referenced new graduates. A perfect time to start introducing the importance of communication to new graduates and how that might be done across different settings as well. Anything final before we hand over for any questions, Amy and Sue, that you'd like to share?
Just so excited. I'm just so excited that this is we've come to this point. I mean, clearly Sue and I are very, very passionate about this, and it's just such a great opportunity to, access to good communication skills training is a massive issue. And this is such a great opportunity to try and fill a huge gap and hopefully fill it in a way that's really valuable for our colleagues and the patients that they're caring for. So we've just really are so grateful that we're able to get this out to the wider community.
Yeah, it's fantastic. I can see the passion from both of you, and we're very happy to be part of being able to spread this wider. Anything final from you, Sue?
I think for me, I had a registered nurse come back to do a second of one of our courses here, and we had gone over the communication skills in it, and she came back and she said, I can't believe it. She said, I had this great conversation with someone and they just thought I was this fantastic nurse. It's just this gorgeous feedback. And she said it was just so good. I didn't think I'd be able to do that. So I think that is, what we want to get from doing the module. That'd be fabulous.
Yeah, fantastic. So we have got a little bit of time. If anyone would like to, you can either raise your hand or put a question in the chat. Anyone who might like to share an experience they've had. Obviously, we've got the joy here of Emma, and we've got Emma joining us, but also Amy and Sue who can answer these questions for you. So Emma, you've raised your hand. If you want to ask your question.
Hi, Sue and Amy. My name's Emma. I'm the nurse educator out in Nepean Blue Mountains Local Health District for palliative care. Fantastic resource that you guys have produced. Just want to acknowledge that it would have been a lot of work. So thank you very much for doing it sort of for all of us to be able to access. I just wondered, obviously there's a big nursing focus. My role supports like the interdisciplinary team. Is this training, I guess the language that you use that we could include it in like an allied health palliative care career pathway that's suitable for other specialties? And then I guess if not, is there a plan to maybe look at that sort of build down the track?
So Emma, thank you so much. Thanks for the thanks for the feedback so far. I've got to say I'm excited and nervous at the same time about having this out there because we did put a lot of work into it. So yeah, so I think it does have a nursing focus. The skills apply to everyone. And certainly when I did the teaching with my colleague in Queensland, that was for a nursing and allied health audience. We taught them exactly the same stuff. So the only thing that is really, I mean, obviously the resource talks about nursing specific scenarios. So, you know, bear that in mind. But absolutely the skills are for everyone. Sue?
Thank you for your comments, Emma. Very, very encouraging. I do think that it's very applicable, you know, across all disciplines. Perhaps, you know, for those allied health teams, they could, you know, look at scenarios that would be, you know, related to them. I think at this point, we'd love to think we could do something else, but yes, not sure whether
We need money to do another thing,
That's
basically.
right.
So I guess that there are certain costs involved in being able to produce something like this. I think, you know, if someone was to give us more money, the only things we'd really need to tweak, we could essentially do the same thing, film some slightly different scenarios that were more applicable to allied health. And maybe slightly tweak the language. But that's all we'd actually need to do to make it, you know, more specifically relevant to the non-nursing cohort. I don't know if that answers your question though, Emma.
No, it does. I guess, no, I mean, look, I think the content and all that is very applicable to everyone. I know that sometimes the people that I sort of am working with can get a bit funny about language that's used if it doesn't have them represented. But I think the module, what's in it outweighs that completely. So I just was
Yes.
curious because we're trying to build resourcing and career pathways for our allied health guys. And I just was looking to possibly include this. So no, I think
Yes.
that all sounds good, but I do understand like building more. I mean, you need the sort of infrastructure to do that. So I completely
Yes.
understand. So thank you very much. I really appreciate you know, your guys' time to talk about it. So thank you very much.
No worries. And I think, you know, that's certainly one of the decisions we had to make, because to make it relevant, to make it really relevant to a group, one of the things you do have to do is look at the scenarios that you're presenting and say, is our nurses going to understand this? And certainly my experience in teaching the different workshops, it's amazing how much that can throw people if the scenario isn't actually directly relevant to their particular job. So that was a decision that we made to make it focus on nursing for now. Thank you.
What we might be able to do too, just thinking about some of that feedback, which I think is really good to hear too, is we might even put another little section just on one of the introduction slides about its usability and across that. We do believe, you know, it does have that usability. It is very transferable skills. There might not be specific scenarios, but yeah, so that might be something we can look at, just making sure we add that in to encourage that as well. And I think Emma had asked a question as well, just about do you get a certificate of completion, which we've confirmed you do. And Emma has made the note that they'll look to include it in their career pathway, and then use the certificate to sign them off of that particular part in their pathway, which is a great idea as well. We've got a comment from Joanne. Thank you all. What a great resource. And Stacey also, not a question, but just wanted to say what a great resource. We've been looking for something like this for our nursing staff, and we'll definitely be utilising this. So fantastic to hear. I know, look, we launched this during National Palliative Care Week, which was only a couple of weeks ago. We have already had 40 people complete it and go through. We're expecting that to continue to grow. And yeah, you can always reach out to us as well if there's any other feedback or comments along the way. So very open to that. Any other final questions before we sign off? Thanks, Brendan. Also saying a wonderful research, and thank you, Sue and Amy. I think that's a great way to sign off, is a big thank you to South East Sydney LHD for taking the lead on this, identifying what a crucial need this is. Sue and Amy, love your passion, and that has come through in this fantastic resource. We're really proud to be partnering with you. So we'll leave it there and wish everybody the best of the remainder of the day. Thank you.